All right, well, welcome. My name's Dr. Hugh Wegwerth, and what I do is practice what we call functional medicine. So, what is functional medicine? That's just actually getting to the root cause of your problem. It's an individualized approach. So, today, what I'm going to be going over is balancing hormones and how critical it is to have your hormones tested in saliva versus blood. So, I'm just going to go over some basic testing that my patients go through. So right here you can see that would be that's an artery, right? And what you have in the artery is all these little things that would be your blood. Now how this actually works is how hormones actually work is this would be a boat right there, okay? So that right there is a boat, and then what sits on top of the boat is actually the hormone, okay? So this yellow thing right there, that would be the hormone. So really what happens in the blood is your hormones are in your blood. When we talk about hormones, estrogen, progesterone, testosterone, your hormones travel on a boat, right? And then the hormone itself sits on the boat. So the way I phrase this is it would be like the package. So the hormone is like the package. So when they actually check these hormones in your blood, they're actually checking this whole entire thing. When hormone is in your blood, it's not actually in your cells, because what happens is once the hormone leaves the boat here, then it goes into your cells. So let's say this would just be, let's say this is your cells here, right? So all these little things are cells. So the hormone has to jump off the boat and then penetrate into the cells. Now, why saliva test is far, far superior is because what we're actually measuring is the hormone that's gotten into your cells. Because let's say here, let's say we're talking about progesterone, all right? So progesterone has actually gotten from the bloodstream into your cells, and then when we have saliva, so let's say this is your saliva, we're actually measuring what we call the free hormone in your saliva. So this is why it's so critical to do saliva testing, is because this is what's actually being delivered into the cells. See, blood here, blood is only measuring, like when you go to when you take a test and they're checking hormones in your blood, it's like what's actually in here. That's not actually what's in your cells. So why saliva is so superior is because if we're measuring progesterone, and let's say we get the saliva, that would be your saliva there, this is the active progesterone. So saliva test is far, far superior, and you need to have your hormones checked through saliva. So here's one of the tests that I do on my patients, and I'm just going to kind of walk you through this. So this is a saliva test. So this is a saliva test right here. And you can see it's a 64-year-old female, right? Now look at this. We measured her estrogen. It's less than 1. Now what you want it to be 1 to 3.2. So she doesn't have any estrogen in her body. Look at the progesterone. Here it's less than 10. We want it to be between 18 and 126. So she's very, very deficient in her hormones. Here's another hormone that we measured is DHEA. She's 64. We want that to be 106 to 300. So this is actually the hormone that's in her cells. So she's very, very deficient in hormones. And another test that we do is what we call adrenal gland testing. So the adrenal glands, good healthy adrenal glands, and this gives you energy. It helps cell growth. It helps hair growth. And there's a lot of things that are needed when we talk about your adrenal glands, and your adrenal gland produces this cortisol. Now over here, you can see here, for example, morning cortisol. You can see morning, noon, evening, and night. So her morning cortisol is 12.01. Now, way over in here, that side, that's the optimal range. So the optimal range is 18 to 35. So she's very, very deficient. And in fact, most of these numbers here, she's very, very deficient. So this is a person that would be having chronic fatigue, not doing very well, having a lot of problems. So this is a real critical information, is getting this through saliva. Now let's go on to the next thing here. Now, we also do some critical testing, which I check for food sensitivity. So you can see this person is very sensitive to basically dairy and egg whites and egg yolks. So why is this so critical? And actually wheaten up there. So what's so critical? If you're eating foods that you're sensitive all the time, this is going to throw off your hormones. You're chronically inflamed. You're only as healthy as your individual cells. Here's some other testing that we've done on her. You can see her glucose is high. Here the lab range is 65 to 99. Ideally, you want this, when you talk about healthy people, you want this less than 85 years old. So these tests that you're seeing is of the same person that has a whole bunch of hormonal problems. Her A1C, which is a 90-day check for glucose levels, and you can see here, what does that say right down here? That she's actually pre-diabetic. So we found her hormones severely lacking in saliva. She also has glucose issues. I also found TSH is for thyroid. So her thyroid wasn't working well. And this insulin here, you can see this is a lab high, it's 23. Now on healthy individuals, we like to see this less than 5. So what's insulin? Insulin is another inflammation marker. If you have high insulin levels, your hormones are not going to be working. So I hope you can attend the workshop that I'm going to be doing on balancing your hormones naturally. You'll have a new appreciation of what it actually takes to get you better. And these are just some of the tests that I do in my office to figure out what's actually the root cause of people's problems when it comes to hormonal issues. Please listen to the video on this page at the bottom. This is a woman that's gone through functional medicine, and her life has completely changed, and what we did was balance her hormones. So I look forward to seeing you at my next upcoming workshop. This is Dr. Hugh Wegwerth.